The medical system prioritizes more the how many patients that you see in a day instead of how good you are with that people. Most of the experience was treatment not like a human. That is why I meet Ana, because it was the first time that somebody that is part of the medical system treat me like a human. So it was very surprise for me and also shock. My name is Leilany Monet Gaytan Castro. I am a Mexican-American. I was born here. When I was 3 years old, my parents moved back to Mexico, and I grew up in Mexico City. This is me when I was a baby. This is my mom, my aunt, and this is my dad. I love my family. And most of them live in Mexico, but yeah, I can visit them 2 times a year. It's a little bit sad for me because I was very close to them when I was in Mexico. We used to visit every Saturday, so we are very close. In September of 2023, I started to study in Seattle World School. I am a full-time student right now at college, Seattle Central College. I am a dental assistant. My experience in the first months here was very kind of difficult. It was a little bit lonely, but also I think was part of because I was having a very difficult emotional situation. I used to take medications. Because of the emotional situation, I was having some appointments from the hospital. I was taking some medicine and taking therapy. Most of the experience was treatment not like a human, very close to the violence. Because of Seattle World School, they have a clinic here, so my counselor, he said that maybe it can be helpful for me start to have some meetings with Ana for my emotional situation.
My name is Ana Short, and I'm a behavioral health specialist at ICHS. I grew up in El Salvador. It's a small country in Central America, and seeing people who don't have access to healthcare really impacts everything in their life. I discovered that I really wanted to do this. I wanted to start helping people navigate, barriers in their life. I really gravitated working with young people. That was kind of something I really enjoyed. Working with people of color, working with people who don't have access. I think, when you experience that yourself, I think that's very important to you, and you want to help people who are on the margins, people who don't have access. Our work here at Seattle World School is very unique. Working with newcomers, we've had to be creative and adapt to their needs. And so that means to provide is the best culturally responsive healthcare that we can provide. Sometimes in healthcare, things can be a little rushed. We take the time to really get to know the students, understand what is it they really need, what's the barriers to accessing healthcare. Like some of our older students, they're not able to access Medicaid because of their age and their immigration status, which is unfortunate because as a young person, and if you've never had health care, we're trying to catch them up to things that they've not had in their lives, like dental care or immunizations or even behavioral health. They've not had those things in their lives. And so we're trying to help them have, again, that equity, the health equity that other people have been afforded in this country and that they deserve as well.
Ana recommended that I can take therapy in Consejo, and I still having my appointments in Consejo. I stopped taking medicine. I think I'm better. In general, I'm better. My inspiration to become a dentist is my dad is a dentist, but just in Mexico. He cannot be here because immigrant status. And yeah, my principal goal is to be a dentist. I like to be with people. Sometimes it's a little bit complicated to do that conversation because they have that mouth open, so there is not many space to have a conversation. But yeah, it's nice to know that you are helping to preserve the health of the people. I think we need that, especially because Latino population have the poorest dental health in the US. So I think representation can be the first step. Equality in healthcare, I think it needs to be a right for everyone. Creo que el sistema de salud debería de concentrarse también en cumplir las necesidades culturales, no solo de salud, y también ver las raíces del problema. What I mean with that is we are not just patients, we are people. Please give generously today and raise your bid cards to support ICHS. Por favor, den generosidad hoy y alcen sus bid cards para apoyar a ICHS.